Just an executive director of health and community education at Piedmont Healthcare. Welcome.
Thank you, Mary. Nice to be here.
And what's your reaction to this study? Are you surprised at all by these findings?
There really are no surprises. We've known for a while that Black women have an increased rate of hypertension, obesity, diabetes, high cholesterol. All of these drive heart disease and stroke. They're all risk factors, and it's something that we want to continue to work on and try to unravel why this is happening.
And why are younger Black women more at risk of having high blood pressure?
You know, Mary, there's something called the weathering effect, and it occurs in Black women dealing with constant infrastructural racism in corporate America, but also in their environments. And interestingly, Black women who are mothers of Black sons have higher reported levels of this stress as they try to teach their sons to navigate an environment in which they are often targets. We also know that Black women go into menopause about a year and a half earlier than white women, probably because of these stress factors, and therefore lose the protective effects of estrogen on the heart that much sooner, further increasing your risk of heart disease and stroke. And so these are all things that we want to begin to unravel to see how we can reduce the chronic inflammatory state in the body that all of these things collectively cause. That would be obesity, the weathering effect, hypertension, cholesterol. They all create chronic inflammation in the body that increases the risk of not only heart disease and stroke, but cancer as well.
What are some signs that signal a person has high blood pressure?
Some of the signs of having high blood pressure might be blurred vision or headaches or swelling of the hands or feet or sometimes dizziness. Something else that is the most ominous sign is no symptoms at all. We call that asymptomatic. It's one of the reasons that hypertension is known as the silent killer.
How can younger Black women get ahead of this and prevent high blood pressure?
So there are a number of things that we need to look at, especially as we're pushing forward to try to understand what is the maternal mortality crisis in this country, because it seems to be connected directly with heart disease as well, and the connection of complications in pregnancy that also increase your risk of heart disease later. So for instance, if you've ever been diagnosed with preeclampsia or eclampsia, gestational hypertension, gestational diabetes, if any of those terms are familiar to you, after your baby is delivered safely, you should be referred to a cardiologist for long-term care, because those symptoms actually have indicated that your risk of heart disease is 2 times higher than a woman without those complications. And that handoff is simply not occurring. And those complications occur more often in Black women, and not only Black women, more often in Black women born in the United States. Black women born outside of this country do not have that increased risk of complications.
What is the #1 factor in regard to high blood pressure that shows that people might develop high blood pressure?
Family history is incredibly strong, incredibly important. Know your family history, but also maintain good weight control. Try to decrease your salt intake. Make certain that you're not living a sedentary lifestyle and that you are exercising and following a plant-based diet in as much as possible. We know that a plant-based diet decreases inflammation in your body. By and large, most of these plants are anti-inflammatory. There are some exceptions, and we know that chronic inflammatory state increases your risk of a multitude of chronic medical conditions. So if you can follow along with these things, and I know sometimes it is challenging, especially with so much processed food around us, and fruits and vegetables are more expensive. But these are all things that we can begin to do to address it.
And Dr. Jane Morgan, thank you so much. We really appreciate it.
Thanks, Mary.